Sa mga participants na maaga, please rename yourselves to include your organization or affiliation. Thank you for joining our webinar this afternoon. We're very excited and grateful to talk about one, if not the most controversial and hottest topic na pinag-uusapan natin ngayon, ang COVID-19 vaccine. Thank you for joining us. I'm Zach Huson from the COVID-19 Action Network Philippines, Civil Society Network, working together to respond to COVID-19 and helping to engage with our stakeholders, especially with the government, on COVID-19 response. I will be your host and moderator in this webisode entitled #AnoNavax, Issues and Misconceptions on the COVID-19 Vaccine. So alam natin na hindi talaga kayo nag-iisa sa dami ng katanungan tungkol sa bakuna. Google will give you 1.2 billion results if you Google COVID-19 vaccine or if you search for COVID-19 vaccine. And more than a year later, since the start of the pandemic, or at least the start of our lockdown in the Philippines, only 390 million people have been vaccinated around the world. So imagine that, no? Ilang percentage yun ng buong population sa mundo. And in the Philippines, around 220,000 people have recently got their COVID-19 vaccine. So although that's something that we should be very happy about, that's still a long way to go before all of us will receive the vaccines, hopefully one day soon. So the question that is on everyone's mind as we think about this topic today is, kayo ba ay magpapabakuna kayo, or will you get the vaccine? No? And if you decide yes or no, why? In this session, our experts from the Health Department and from the National Immunization Technical Advisory Group, or NITAG, will be joining us in our discussion. Dr. Beverly Lorraine Ho, Director for Health Promotions and Communications of the Department of Health, will share with us some updates on the status of the country's vaccination rollout program. Meanwhile, Dr. Eddie Dorotan, Galing Pook's Executive Director and a member of the country's consultative body of experts on immunization, will help us clarify our questions on COVID-19 vaccines that are available in the country. We will also have the most important part of this webisode, of course, your questions, and we will ask our panelists to answer them. I encourage you to please either type in your questions sa chat box natin. Kung nanonood po kayo sa social media, you may type in your questions also in the comment section, and of course, our facilitators will be gathering these questions and hopefully replying to you as well in the chat box. So please continue to ask your questions. And of course, for our attendees today on Zoom, you will have time later to unmute and ask your questions directly. So without further ado, I'd like to welcome our first speaker, Dr. Beverly Ho.
Good afternoon, everyone. Good afternoon, Zach. Thank you for having me here once again. Good afternoon, Doc Eddie and Joanne from Galing po. Hi.
So please tell us, Doc, what's the latest and what should we all know about the vaccine?
There are many things that we need to know about the vaccines because we need to be constantly informed about new scientific information that's coming out. But we're also happy to let everyone know that the planning and the implementation is actually very much in place, and that's with the help of a lot of our different government entities and also some private sector entities, as well as some NGO partners who are helping us with a lot of the demand generation activities that we saw. So magandang hapon po ulit sa inyong lahat. Thank you for having us here, ni Doc Eddie, to share the latest on COVID-19 vaccination in the country. The organizers have sent us your questions in advance, and I hope to address many of them during the presentation po para mas efficient yung Q&A natin ni Zach later on. So thank you to a few people who actually were the source of information of the slides that you'll actually be seeing today. First, I'd like to begin with this chart, which emphasizes to us who are infected or who are affected by COVID-19, but more importantly, who are dying from COVID-19. And the graph on the right-hand side clearly shows us that it's people more than 60 years old who are gravely affected by COVID-19. No? So, yung nandito sa kaliwa, they get it, but they survive, no, COVID-19. So, yung second key point that we all need to realize also is that sometimes when people talk about, ay, na-COVID siya, no? Nagka-COVID siya. Yung mental picture natin could just probably be a person, no, in a room in an isolation facility. But actually, it could be very, very different, no? Pwede siyang mild, no? So, cough, colds, and the chance of death is little to zero. Then you have moderate, which would mean that that person will require some oxygen support and less than 1% can die. And then you would also have severe form of COVID-19, which would mean that the person will be in respiratory distress and would require really admission in a hospital, and around 5 to 10% can die. No? If we look at it, kung upot-sipon lang yan, diba? It's something that all of us encounter on a year-to-year, day-to-day, month-to-month basis. Diba? But the main difference about COVID-19 is the fact that it can actually cause severe infection, which can take away lives of people close to us. At ito naman talaga, no, yung severe infection, yung nakapagpatakot talaga sa atin, di ba? Yun yung dahilan kung bakit nabagabag, no, yung buong mundo, and even high-income countries, they were severely disrupted by COVID-19 infection. So, these 2 points, I hope maging maalala natin siya as we later on think about the vaccines that we probably will be choosing or will be having ourselves inoculated with. I'll begin the entire presentation in a entire parang Q&A format na po, no? Para mas mabilis. So there are many concepts, but I do hope that this would facilitate us understanding the key concepts. So first question is like, why do we need to get ourselves vaccinated? And I think there are 2 very important answers to this lang po. No? First is to protect ourselves, and second is to protect the vulnerable or the people who are unable to protect themselves. For example, for the first bullet, we are able to protect ourselves through 3 different ways that the vaccine has impact. So that's preventing symptomatic infection, preventing severe infection, and preventing transmission. I'll talk about this more later on, but then sa second bullet, protecting the vulnerable, this is related to the concept of herd immunity. So let's go to the slide first. No? Lahat tayo, yung goal natin is magkaroon tayo ng some form of immunity, diba? Or protection against what is in the slide I showed you kanina, no? Particularly severe infection. There are 2 ways to get immunity, one from natural infection, and that would entail you getting the entire experience of COVID-19. Or there's another way to achieve immunity, which is through a vaccine. No? So magkaiba yung experience na yan. Yung kabila, pipila ka, tuturukan ka, may konting sakit sa injection site, merong pwedeng sumakit yung ulo mo, maglagnat ng konti, no? Yung other naman, kailangan mo i-go through yung entire process na na-isolate yung mga tao, no? Etc. But in both cases, you acquire immunity. Right? In those 2 instances, the trigger point would be for natural infection, an antigen, and for immunization, what we call an immunogen. No? So si antigen, yung talagang bad guy, siya mismo si COVID. Pero si immunogen, yung parang gumagaya kay COVID, pero nasa loob siya ng bakuna. If we look at this graph on the right-hand side, meron tayong boxes sa taas, may boxes sa baba. The simplest way I can describe it to you is that all of us are considered blue now, diba? So we are the susceptible people or the naive population. And when someone who's infected na naka-red goes around, we can be transformed to be color red. No? We can be infectious, and then that person eventually recovers. Siya na si yellow, diba? And so the last box on top, you'll see that more and more people get infected, and eventually they recover. So yan yung state natin yun. Where we want to get to is the bottom part, which is that most of us are going to be considered recovered or immunized na, yellow na tayo, so that when someone goes around na color red, hindi tayo maa-affect. No? But more importantly, this is why it's not just for us, but for other people, is if we have enough yellow people going around, those that are blue, who are unable to get themselves vaccinated, are going to be protected. No? In another way, you can look at them as, yung mga nakisakay no, sa bus na hindi nagbayad, pero nakarating sa destination. Free riders sila, pwede, but some of them really have no choice but to be free riders, no? Because they needed the protection coming from all of us. And so, these probably 2 sets of diagrams can show you why it's important for at least all of us na walang contraindication, dapat magpabakuna tayo to help those who actually can't get the vaccine. So, baka sabi ng iba sa inyo, ay, okay lang naman, magiging immune naman pala ako in any case, no? Ang ano lang natin dito is kapag nag-go through ka dun sa taas, na naging red ka muna bago ka naging orange or immune, you always have a chance of dying, di ba? Mas mataas yung chance mo dun. kaysa magpabakuna ka. Sabi natin kanina, si antigen, siya si COVID, di ba? Yung immunogen is parang gumagaya, no, sa COVID, pero siya yung nasa laman ng bakuna. So there are actually many types of immunogen, as you can see here on the left-hand side. So it could be a live virus, an inactivated virus, a protein subunit, some part of the virus lang. And then here we listed down how it works, its many advantages and disadvantages. But you'll also see on the right-hand side the different types of vaccines that we have been using in the past 40, 50 years as an example, no? So makikita nyo, hindi naman to bago, no? The technology, except for nucleic acid, yung mga mRNA, which is your Pfizer and Moderna, apart from them, halos lahat po sila nagamit na in the past. No? Hindi na to kailangan toxicin. We'll share the slides with you. But I hope when you remember what vaccines are, sana ito yung maisip nyo. No? So I would liken vaccines as either a practice, no, a dress rehearsal or a swimming lesson, or actually ito po, no, yung wanted sign for mga robbers, hold-upper, di ba? So when you have a bad guy in the community, hindi natin sila kilala. So when we don't know them at walang wanted sign na nakapost, we will still interact with them, no? And put ourselves at risk. The idea of the vaccine is that it tells your body who the bad guy is already, even before the bad guy actually approaches you, no? So marunong na yung katawan mo, nakapag-practice na siya. In a certain way, this happens, no? I screenshotted here for very detailed way of how the vaccines work against COVID-19, the COVID-19 vaccine. Makikita nyo where I encircled the red circles, parang meron po siyang isang amoeba dyan, no? So that's what we call an antigen-presenting cell, no? So ang trabaho lang niya, maging tagahawak ng billboard na sinasabing ito yung wanted, no? At makikita nyo, in all of the vaccine, regardless of what they are, meron kang antigen-presenting cell at may nakakabit sa kanyang mga pula-pula, no? Yun yung coronavirus peptide. Sipin mo, yun yung some part of the COVID virus, di ba? So, ang goal lang niya is ipakita, no, na ito na siya. Hey, everyone in your immune system, nandito siya. Ganito yung itsura niya. Let's try to practice. And that will trigger a whole set of immune response. So imagine the antigen-presenting cell is probably the person holding the wanted sign, di ba? O pwedeng siya rin yung puno, no? Kung saan mo kinakabit yung wanted sign. And the guy in the wanted sign are the red dots, no? The coronavirus spike peptide. So very easily, that's, I guess, how we would describe it. And the whole point of this is whatever the mechanism of action of the vaccine is, ang dami niyan, gusto niyo siyang aralin, pwede naman. Pero yung endpoint niya is the same, no? Its role, its entire goal is to make sure that the coronavirus spike peptide gets recognized by your body and your body mounts an immune response. The other concept that we were talking about kung bakit tayo kailangan magpabakuna is to protect ourselves, no? And this is Dr. Edsel's description, no, of how we could actually do it. A vaccine can help prevent symptomatic infection, it can prevent severe infection, and it can prevent transmission. So, yung pag-prevent ng infection, parang liken the coronavirus, yung bangis, no, nung virus, as parang bangis ng isang layon. But with the vaccine, you prevent the symptomatic mild infection, meaning parang kinulong mo siya, hindi mo na makita yung bangis niya masyado, ginawa mo siyang puting, no? Or you prevented severe infection, imbis nakakainin ka niya ng buhay, parang kalmot na lang, no? So that's prevention of severe infection. At yung huli po, prevent transmission. So parang essentially, you killed the virus. So among all of these, the last point, yung preventing transmission, yung hindi pa sila masyadong established sa evidence, no? Pero yung first two items, they're pretty established evidence. So ano lang yung importante dito? Oftentimes, when the information gets published in newspaper articles, yung preventing symptomatic infection, hindi siya masyadong, yun yung lagi lang na sinasabi, no? 90+%, 70+%. Atong preventing severe infection, hindi siya masyadong lumalabas sa article. At sana, pagkatapos ng talk na to, ito po sana yung maalala ninyo. That you always have to look for two numbers, di ba? So first would be the number, the efficacy in preventing symptomatic infection, and second, the efficacy in preventing severe infection. And I would like to emphasize that most of the vaccines that have already been approved, comparable sila lahat dun sa preventing severe infection. Halos more than 90% sila lahat dito. Which vaccines will we use? So far, we do have a portfolio of 7 vaccines. And out of all of the 7, FDA has already issued 4 EUAs. No? Yung Gamaleya, today siya na-release. And then all of them are 2 doses except for the Janssen, which is 1 dose. And we just wanted to show you that there are many independent vaccine expert groups who are helping us evaluate the vaccines in different angles. Now, it will be important to note because many are still wondering, minadali ba yung bakuna? So the answer there is prioritize siya. No? So kumbaga, the entire world did all hands on deck on the vaccines. And that's why we are easily at phase 3 trial within 1 year of the pandemic. No? Typically, this ranges from 3, 4, even 6 or 10 years. So now the question is, kapag nag-phase 3 trial ka at tapos na yung phase 3 trial, which is typical noon, mabibigyan ka po ng Certificate of Product Registration, CPR. What happened now is hindi pa po tapos yung mga phase 3 trials ng all of the vaccines, no? Including Pfizer, Moderna, everything. No? They're not yet done with phase 3. But because of the pandemic, it has been realized, no, or the experts have recommended that using it will already be beneficial more than the risks that we all face. No? Kaya binibigyan sila ng emergency use authorization. Now, ang tanong dito is, ano ba yung benefits outweigh the risk? No? Maaari mo siyang isipin na lahat ng ginagawa natin ngayon, wala naman talagang risk-free, di ba? So, for example, you can go out of your house to buy something, gusto niyong kumain, no? Pero paglabas mo ng bahay mo, may risk ka naman talagang madapa, masagasaan, di ba? All of them, kahit konting risk, no? But you still do the activity because there's gain, no? There's a gain in what? In happiness, in satisfaction, or if you're gonna go to work, there's gain in economics, di ba? So, importante yun to think about, ano ba tong vaccines, no? Completely ba zero yung risk? Hindi, no? Hindi naman, no? Meron ka pa rin risk of some form of adverse reaction, which we can talk about later. Pero yung pinakamahalaga dito is, mataas yung benefit kumpara sa risk, kaya nire-recommend ng experts that we take the vaccine. Now, here's a summary of all the vaccines that we have, the temperature at which they could actually be stored, and some contraindications. So I think what's important to highlight here is that for the 2 vaccines, particularly Pfizer and Moderna, they require colder temperatures. And because they require colder temperature and more advanced types of freezers, if they get bought, they will be deployed in areas with those infrastructures. So dito lang, we just put Sinovac and Astrazeneca, which are now currently being rolled out, and their EUAs. We also often get the question whether a person will receive the same brand for both doses. Yes, no, that's the case. Now, what's happening lang po, so for Sinovac, people will get their first dose and then after 28 days, their second dose. But for AstraZeneca, yung mga nababasa nyo ngayon, because of evidence po, no, nag-umpisa na after 4 weeks, tapos sinabi 8 weeks better, no? Ngayon, after 12 weeks, tsaka po maximum yung benefit. So dahil ganun po, yung mga naturukan po ng AstraZeneca in the country will receive their second dose after 12 weeks. And that puts us in a situation wherein all the Astra doses now originally naka-reserve yung second dose para dun sa same person, magiging mapupunta na po siya muna sa ibang healthcare worker, tapos pag dumating yung second shipment, tsaka na po sila bibigyan ng second dose. No? Kasi medyo matagal pa naman nila kailangan yung second dose. So, can you decline? Of course, anyone can decline the vaccination, but if you forfeit your slot, then you will actually, it will take time, no, before you actually get your slot again. So do you have to pay for anything or is the vaccine free? So the overall government policy is it has to be made free, no? So for private entities or LGUs that went into tripartite agreements, yung mga nakikita nating mga MOA signing nila with pharma companies, ang condition po dito is that they actually provide it to their employees for free, no? So hindi po magbabayad yung mga empleyado. Now, ano po yung goals natin sa ating vaccination program? Bakit may ibang tao mauuna? Bakit yung iba sa atin kailangan pong maghintay? Yes, people talk about herd immunity as a goal, no? Pero how do we clarify the objectives? So our primary goal is really maintenance of the most critical essential services. Ibig sabihin, hindi pwedeng mag-collapse yung healthcare system at kailangan nating bawasan yung morbidity and mortality. Ibig sabihin, bawasan yung mga namamatay at bawasan yung na-ICU, no, or malubha yung kondisyon. And after that, saka magiging controlling transmission, minimize disruption of socio-economic and security functions, etc. So dahil po dito, sino yung mauuna, no? So meron pong ginawa yung ating NITAG na priority sectors, no? Mamaya po si Doc Eddie, siya po ang isa sa mga members ng NITAG, sila po yung nagdedesisyon at nagre-recommenda nito. Pero importante rin po na alam natin na meron pong two other criteria, no? So kahit mauna yung sector na yon, since the vaccines all won't arrive at the same time, then meron pa po tayong some prioritization. Geographic location at exposure or mortality risk. So, kunwari po, among healthcare workers, kung ikaw ay taga Manila, mauuna ka kasi mas maraming kaso dito, mas mabigat yung burden dito kaysa sa siguro Batanes, no? Kasi wala silang masyadong kaso. The same way, sa healthcare workers, yung mga nagpo-provide ng care at humaharap sa pasyente, mauuna silang makakakuha kaysa sa people who are doing perhaps telemedicine consultation only. And then among seniors, nakita niyo dito, mauuna yung mga highest age group kasi mas malakas yung risk nila kaysa sa lower age groups. No? So yun yung mga examples lang na may sub-prioritization tayo. Here, we outline sino yung mga nasa priority group A, healthcare workers, A1, A2, senior citizens, A3, adults with comorbidities, A4, frontline personnel, A5, poor population, no, based on NHTS. And then there's priority group B, and then there's priority C, which is the rest of the Filipino people. I think what we want to highlight dito sa frontline healthcare workers ay meron pong sub-prioritization as I mentioned kanina. So mauna po talaga yung COVID referral hospitals, bago yung hospitals catering to COVID-19 cases, bago tayo umabot sa dulo, no? So, yung mga pagtatanungin nyo, paano yung mga rural health unit, mga health center, number 5 sila. No, paano yung mga ibang laboratories, dialysis clinic? Okay, number 6 sila. Paano yung mga quarantine facility? Number 3 sila. No? So hanggang matapos, tuloy-tuloy po yung pag-cover natin. Next, yung senior citizens, numbering to about 9.8 million. And then adults with comorbidities, mga ibang sakit na pinapakita dito. Then frontline essential workers that NEDA will be deciding on, and so on and so forth. So when people ask when and where will I get vaccinated, it really depends on your priority group and when the vaccines are arriving. But it's important to note that yung LGU po, yung pinaka mag-aanunsyo po sa inyo. Strategiya po natin ay tinatawag na fixed post strategy. Ibig sabihin tayo po ay kailangan pumunta sa isang facility at doon magpabakuna at hindi po sa bahay natin, no? Because there's an observation period that needs to be undertaken. So kung kita niyo po dito sa diagram na to, ang ating social mobilization strategy ay house to house, no? Ibig sabihin, yung mga health workers natin on the ground are talking to the community since January, convincing them, explaining the benefits of the vaccine. And town halls like this, in a way, parang house to house, no? Kasi kayo, malamang nasa bahay yung iba sa inyo. But our vaccination is actually fixed post. Then, here, sinasabi lang po natin, no? Ito po ay something that our NITAG has also recommended. Talaga pong mauna mula apari hanggang holo, lahat ng frontline healthcare workers natin at senior citizens. At pagkatapos na doon, pwede na pong sabay mag-roll out yung national, LGU at private companies as long as we all follow the prioritization. Now, ano yung ginagawa po ng LGUs usually? Ang LGU is actually in charge of master listing. Doon po kayo magpapalista. They're also in charge of micro-planning. Ibig sabihin, hahanapin kung nasaan yung mga facilities, sino yung mga bakunador nila, gagamitin ba nila yung schools nila, gagamitin nila mga gyms, will the military medical personnel help out, etc. At sila din yung in charge ng mag-make sure na mangyari po yung training and simulation. At this point in time, most of the LGUs have already undergone the training. And because nag-practice na tayo, yung healthcare workers natin, nakita na ng lahat paano nangyayari yung dating nasa papel lang. Then we're more confident that when we roll out sa atin na pong lahat, sa rest of the population, then medyo mas equipped na yung mga LGUs na. Meron din po tayong tinatawag na quick substitution list. Ibig sabihin, ayaw nating may masirang any vaccines. So, in all facilities, meron pong dapat na karelyebo. So, it means, kunwari San Lazaro Hospital, meron po silang X number of bakuna. Kapag 3 p.m. na, kunwari, meron pa silang tira dun sa vials nila at wala nang magpapabakuna sa hospital nila, pwede silang tumawag sa either katabing health center, katabing hospital, pero nakaplano po ito para siguradong may pwedeng humabol at ubusin yung bakuna. People ask if they're eligible. So, unang-unang advice namin is really seek consult from your primary care provider and declare your complete medical history. Iba-iba po yung advice natin, So, if the patient is less than 16 years old or 18 years old, may allergies and severe allergic reaction after the first dose, hindi po dapat bakunahan. If they have symptoms, likely COVID symptoms or other infectious disease, previously treated for COVID-19 in the past 90 days, had treatment, etc., they will need to defer vaccination. Ibig sabihin, pwedeng bakunahan pero hindi muna ngayong araw. Healthcare workers and pregnant in the first trimester, reschedule. So, pag second and third trimester, pwede na. If received any vaccine, flu vaccine, or kahit ano pang ibang bakuna the past 2 weeks, reschedule ulit after 2 weeks. Now, if the patient has any of these following conditions, may HIV, cancer, transplant, so medyo specialist requiring na pasyente, kailangan po nila ng clearance from their attending physician. And finally, kung merong mga allergy naman sa pagkain, sa itlog, sa ibang gamot, or with asthma, pwede pa rin naman magpabakuna. It's just that instead of 15 minutes silang obserbahan, 30 minutes to even 1 hour po sila o-observe. And then if with history of bleeding disorders or taking anticoagulants, ibig sabihin mas madali pong duguin, so special case sila, yung needle na gagamitin sa kanila, mas maliit po. What can you expect during the vaccination day? So, syempre, suot mo pa rin lahat ng gears mo, di ba? Mask, face shield, dala mo pa rin yung alcohol mo. You'll sign the informed consent and basically go through the following process. Registration, isa-scan na lang yung QR code na nabigay na sa'yo. Health education and consent, then is-screen ka ulit, kasi may sasagutan kang health screening form. Magtatanong talaga sa'yo, totoo ba yung mga nilagay mo doon. Then you get vaccinated. And finally, post-vaccination monitoring. So, medyo ganito po yung overall na itsura. In some areas, hindi po kasi malaki, So, medyo parang kwarto-kwarto po ito. Pero overall, you have a waiting area. Then, you enter to do registration. Habang naghihintay, nanonood ka ng TV na merong mga information content doon about the vaccines. Then you get screening where you get your BP, temperature, physical exam, magsistethoscope sa inyo, diba? At i-verify yung history mo. then you get vaccinated. After you get vaccinated, maghintay po kayo sa isang area. No? So as much as 15 minutes for regular people, 30 minutes to 1 hour for those with higher risk. So may itsura po ng informed consent form dito. Just put it here, and a physical vaccination card which you will get. So the electronic vaccination card will also be available just in case na wala niyo po. Then, as I mentioned kanina, yung recommendation po, 15 minutes for general population and 30 minutes for the rest of the population. So what should you do after? We want to emphasize that usual symptoms may actually be experienced. So what are these usual symptoms that we shouldn't be afraid of? Swelling, pain, redness, headache, fever, fatigue after a day or two. But all of these are normal adverse events. So yesterday, DG Eric Domingo of FDA, nag-present po siya nung mga datos na nakuha natin ngayon. As of this time, on average, around 3% ng mga tao ang nagkakaroon po ng mga reactions like this sa lahat ng nabakunahan. So, kung siguro 1,000 yung mga 100 people, 3 yung magkakaroon ng reaction. Kung 1,000 yon, 30, no? So kung 10,000 yon, 300. So kaya wag po tayo matatakot, kasi kung habang marami tayong pinabakunahan, medyo mas marami tayong maririnig, na people who will have these reactions. But it's a small percentage. So what you don't want to happen on the day itself is actually yung what we call allergic reaction that's severe, which is an anaphylaxis. So yun yung talagang hindi na makahinga, kailangan pong i-emergency room. So in those cases, meron po tayong guidance na galing sa Philippine Society of Allergy, Asthma and Immunology kung paano po ito i-manage. Kaya po importante na magstay tayo dun sa area within 15 to 30 minutes and even to an hour to get ourselves observed. Now, kung may mangyari po after the vaccination, pag-imbestigahan po siya ng mga health authority. Then, maraming nagtatanong, can you actually stop practicing minimum public health standards? Hindi po, So, may small evidence ngayon yung CDC na baka pwede pong mag-stop na. Pero, it will be among people who actually had the vaccine already. Considering na sa atin, hindi pa po massive yung rollout, and in many other countries, patuloy pa rin po, kahit marami na silang naka-vaccinate, nagmamask pa rin sila, nagfa-face shield pa rin sila. Kasi nga po, you still don't know, the protection is not guaranteed 100%. You may still have COVID, but it's just mild COVID or asymptomatic COVID. And pwede ka pa rin makahawa. Now, we emphasize that the vaccines are only a layer of the entire spectrum ng mga protection natin, consisting of personal responsibilities, mga kaya natin gawin, versus shared responsibility ng maraming tao. Kung mahirap naman po ito intindihin, mas madali siguro to, mas alam natin sa Philippine context. Parang ayaw lang natin makagat ng lamok, di ba? We don't do just one intervention, but a combination of interventions. Insect repellent, wearing long sleeves, paglalagay ng screen, kulambo, katol, di ba? Hindi siya isa lang yung ginagawa natin. Make sure talaga natin hindi makapasok si lamok, So that's in a way the same way dito, We do a lot of interventions to make sure COVID does not get to penetrate. So the final part of this presentation is really that a reminder to everyone that when we're given a vial of vaccine, wala pong makaka-verify kung maayos yung laman niya o hindi. So it's important for us to only trust the correct supplier, meaning yung galing siya sa local government or dun sa actual na source ng national government na pinasa po sa local government. At mahalaga din pong alam natin na hindi po basta-basta lang na refrigerator or bag na may ice nilalagay yung bakuna. Kapag ganon, biologic agent po siya, pwede siyang masira at pwede po maging toxic substance. So that's something that we don't want to do. Pag may magsasabi sa inyo, uuwian ko kayo galing sa ibang bansa ng bakuna, please sabihin na lang thank you. Kasi sira na yun likely pag dinala sila sa inyo. So I think I'll end there with the source materials for all the advocacy materials that you might want to use for your organizations or for your family, friends, or coworkers. So yun lang po. Thank you very much. Back to you, Zach.
Thank you, Doc Bebs. Siguro ilang beses mo na itong na-present na, no? Well thought out presentation. And just a reminder that this is also recorded on Facebook. So a lot of people will want to watch this. I know I'm seeing comments now na this is very helpful. Please tell others, your friends, family, na pwede nyo panoorin to ulit. So if you want to learn more about the vaccine, you can watch this whole webinar, no? So thank you, Doc Bebs. There's a lot of questions. I know we've sent you some of these questions earlier. But before we go to our next speaker, let's just talk muna ano bang mga terms ng bakuna at yung brands, no? And we'd like to show us a quick infographic. Ang daming brand kasi ng bakuna. May Pfizer, Biotech na may 95% efficacy rate. Moderna, I think, has about 94%. Gamalaya has 92%. Novavax has 89%. Astrazeneca, na I think that's the vaccine that's one of the two that are available now, has 70%. Johnson & Johnson has 66%. No? And then, of course, yung CoronaVac or gawa ng Sinovac has about 50% efficacy rate. So, ano bang ibig sabihin nitong efficacy rate? No? At nandito ngayon para ipaliwanag yon si Doc Eddie, na Executive Director ng Galing Pook Foundation, and of course, Doctor of Medicine, to explain this. Doc Eddie.
Ay, magandang hapon sa atin lahat. May nagtanong, at ang unang tanong, ano ba ang bakuna na pinaka-epektibo? Di ba? Kasi sa ngayon, actually, sa buong mundo, meron na tayong actually 10 brands na iba't ibang klaseng vaccines na niro-roll out na sa buong mundo. No? And mind you, dahil sa, of course, alam natin, no? Minsan yung mga mayayaman, no? Alam natin, no? Most of the time, mga 10 countries lang nakaka-corner ng more than 75% of the available vaccines now. And kanya-kanya, no? So America, Pfizer, Moderna, and lately yung Johnson & Johnson, papasok Novavax. Of course, sa Russia, yung Gamaleya, Sputnik. Pag nakuha mo yung makakarating tayo sa buwan. Sputnik. Tapos yung Sinovac and Sinopharm naman ay galing China pero nasa, alam ko, mga 18 provinces na. Yung Gamaleya nasa 51 countries na. And 72 countries ang Gamaleya. Ang Pfizer. Okay, yung Astrazeneca nasa 72 countries na rin. No? So, ang tanong, alin ba sa kanila ang pinaka-epektibo? Sa amin, dito sa Pilipinas, ang sabi na yun, basta sinabi ng FDA natin, sina Eric Domingo, at nakita ng sinuri din ng Health Technology Assessment Council natin na okay, ibig sabihin yan, epektibo lahat yan. Epektibo at hindi lang epektibo, safe, no? Ligtas yan. No? So sa WHO po kasi, ang benchmark ng efficacy ay dapat more than 50% effective dapat ang bakuna nyo in preventing the disease, no? Yung symptomatic disease. Ibig sabihin, kung ang Sinovac ay nag-range sa 50 to 90 or mga nasa 70 or 70, depende. No? So more than 50.4, ibig sabihin, pag nabakunahan ka ng Sinovac, may 50% na protection ka na hindi ka magkakaroon ng sakit, no? Na symptomatic. At actually, ang mas importante pa dito, mga more or less 100% ka na, 90 to 100% protected ka na magkaroon ng severe at mamatay ka. No? Ganun din sa Pfizer. Kung ang Pfizer mo 95%, ibig sabihin naman nun, 95% na protektado ka. Now, having said that, ang benchmark ng WHO at ng FDA natin, dapat more than 50% okay na yun sa'yo. Kasi nga naman, in the context na scarcity of vaccines, kailangan umaksyon kaagad tayo sa kung anong meron dyan na effective naman, gawin na natin, di ba? For example, Sinovac, 50%, 50.4%. No? Okay na yan kaysa wala kang protection, di ba? So again, the brands will not matter. Basta, sa amin dito, sabi na, basta approve ng FDA natin, tsaka EDSTAC, okay yan. Kasi pinag-aralan niya ng masusi in terms of the clinical. Makakapal pala ang mga papeles ng mga clinical trials yan. No? At tinitingnan yung experience sa buong mundo. So sa ngayon, ang nabigyan na po ng EUA ay Pfizer, ang Sinovac, AstraZeneca, at yung recently ngayon lang, yung Gamaleya ng Russia. So yung apat po, epektibo po yon. So may nagtanong din dito, Zach, sa mga brand, alin ang pwede sa seniors?
Oo,
diba?
Yes, may nagtanong nun.
Okay. In general, kung titignan mo sa buong mundo, sa WHO, tsaka sa mga FDA na iba, pwede lahat yan. But yung FDA natin, specific din tayo. So halimbawa, sinasuggest ng FDA na ang Sinovac, for example, 8 healthy 18 and above, tapos hindi muna sa seniors. Mainly because yung pag-aaral sa Sinovac, hindi pa nakakita yung sa clinical trials, hindi nila binigay yan sa mga seniors. But it doesn't mean na it will not work. Ang pagkaintindi ko rin, Sinovac po ay ginagamit na sa 11 countries like Turkey, Indonesia, Hong Kong, para sa seniors. So, again, ang sinasabi natin dito, yung mga vaccines natin ngayon ay marami pa tayong hindi alam, marami rin tayong alam. As we move on, nakikita natin mga evidence and we adapt. No? So, for example, kung makita ng FDA na pwede na pala ang Sinovac for elderly, pwede yun. In fact, yung mga health workers natin, may mga more than 16 na nag-receive na. Mag-waiver lang sila. So, pero ang pinaka-guidance natin po ay yung FDA tsaka yung ETSTAC. Yung Astrazeneca, ayan, okay rin yan sa mga matatanda. Yung Gamaleya, yun din ang alam ko, 18 years and above. No? Basta ang sinasabi natin, sinabi ito ni Dr. Bev, na ang babakunahan natin, mga healthy, ibig sabihin walang sakit, walang fever ngayon, hindi mahina. So, kaya nga may screening. No? And hindi naman ibig sabihin na hindi na sila babakunahan, but i-defer mo kung okay na sila at saka pwede. So, yun po, no? So, basta FDA at ETSTAC approved, makakasiguro tayo na tama pong bakuna, safe and effective. Opo.
Maraming salamat, Doc Eddie. I think yung isang tanong na related nun, no, is kailangan ko pa talaga magpapakuna? I mean, may choice ba ako to not get the vaccine, and why would I choose that? Is that the choice that's in my best interest and in the best interest of my family or my friends, my loved ones?
Tayo naman ay democratic country tayo. No? Hindi naman tayo isang authoritarian country. And like any other sa medicine naman, no? Voluntary po yan. No? Ibig sabihin, ang national immunization natin ay voluntary. So, pwede ka maghindi. But we will convince you na magpabakuna kasi it's in your own interest at it's on the interest of your wife, your children, and your neighbors. No? So in effect, parang ang bakuna po ay parang public good na hindi lang sarili mo iniisip mo Iniisip mo rin yung iba. Kasi pag nakabakuna ka na, less ang transmission mo siguro, tsaka mapoprotektahan mo, di ba? Lalo na kung marami na kayo, tinatawag namin ni Dr. Ben na herd immunity, mga 70%, ay hindi na ito makakahawa ng marami. And therefore, we can regain yung economic activities natin. For as long as nandyan yung virus na hindi pa natin control. Ngayon may surge, ha? In fact, ang surge ngayon parang pinoproject nila mas higher to kaysa sa last August, no, last year. Mayroon tayong 4 na variants, no? And kailangan masugpo natin. And one of the key intervention talaga natin is vaccine. But sabi nga ni Bebs, hindi lang vaccine. Kahit nabakunahan ka na, mag-mask pa rin, maghugas ng kamay, tapos yung social distance. 4 dapat, saka yung ventilation.
Doc Bebs, may idadagdag ka ba doon? Ang isa pang question, I think we have a good question also from Sandy from Ideals. No? How do we promote yung vaccine confidence if we do not know the long-term effects? Kasi sabi nyo nga, it's under study, under phase 3 clinical trials. How can we convince the public that kahit na yung current studies should be sufficient for determining the safety of these vaccines?
Tumitingin tayo sa siyensa, no? Alam natin na ang vaccines panlaban sa polio, sa measles, sa tuberculosis, Ebola, SARS, flu ay effective, no? So, meron tayong pinagbabasihan ng vaccine. Kaya nga tayo naglalagay ng public. In fact, one of the best achievement ng mankind is the development of vaccines. Because kung walang vaccines, ang dami mamamatay, di ba? Ang dami magkakasakit, ang dami mamatay. Now, having said that, itong mga vaccines natin, safe ba to? So, sa tingin namin at this point in time, kasi phase 3 pa lang tayo, so far, very safe, no? Bawa yung nasabi na sa Norway na binakunahan o namatay. Kahit dito ngayon, no? May binakunahan na Sinovac, tapos may namatay. Hindi naman related, no? Hindi naman related yung pagbakuna sa pagkamatay. And here, ito yung point ko din sa Dengvaxia kasi meron tayong hesitancy kasi Dengvaxia. Ang problema kasi natin, masyadong natakot ang mga tao kasi ang pagkaisip, pag tinurukan ka ng Dengvaxia, mamamatay ka at kinakasuhan ka pa. So, ang tingin ko mali yung ginawa nila doon dahil sa hindi naman napatunayan na related yung pagkamatay, Dengvaxia vaccine. And therefore, we would like to assure our people na safe po to at long-term makakatulong po sa atin to. Kasi kung wala ho tayo nito, pabalik-balik to, magkakaroon ng maraming variants to the point na pabalik-balik to, and we cannot go back to our normal ways of life. economically, socially, culturally.
Some practical questions lang din. Safe ba yung vaccine for those with chronic bronchial asthma?
Yeah, in general po, yung mga vaccines natin, ang sabi ng mga eksperto natin, mga experts sa infectious disease. Kaya nga inuuna natin yung mga senior citizen kasi sila yung may mga sakit. No? Inuuna rin natin yung mga adults with comorbidities, may hypertension, may bronchitis, may asthma, may chronic renal disease. Kahit yung mga matataba, kasi sila yung, sa pag-aaral natin, sila yung tinatamaan ng grabe. Nakita mo yung unang slide ni Bebs. Pag tinamaan sila, karamihan sa kanila, kasi meron siyang comorbidity, tawag, may sakit na, sila ang napupunta sa severe at namamatay. And therefore, ang sinasabi namin, pag ininectionan ka, may protection ka from developing severe disease, lalo na sa mga comorbid. So, makakatulong po. So, kung meron po kayong hika, ako may hika, pwede ako magpaturok. Pero kung grabe ang hika mo, no, nasa acute asthmatic attack, baka suggestion ko huwag ka muna paturok, tuturukan ka muna para sa hika. Hanggang sa umayos ka, pag umayos ka na, tsaka tuturukan.
Okay. Thank you, Doc. May tanong tayo from Wendell dito sa attendees natin. May tanong po about how can, number one, can those who are vaccinated continue to be carriers? And then secondly, if they can, how will that increase herd immunity if they can continue to carry the vaccine? The COVID-19.
So ngayon, ang important, diba, as we mentioned kanina in the slides, is the fact that COVID can become severe. Man talaga yung kinakatakutan natin lahat, no? Because you can't really remove mild type of respiratory infection. Kasi nga, every year nagpo-flu, like nagkakaroon tayo ng mga flu, di ba? So, trangkaso yan. So, nandiyan naman siya talaga. Yung ayaw lang talaga natin is the big risk na ikamatay siya. No? Kasi yung regular trangkaso naman, hindi naman yung kinakamatay ng elderly, for example, di ba? So, that's the main reason why we want the vaccine, di ba? But then, in terms of like transmission, the evidence is still not sufficient, no, to say that merong transmission blocking properties yung lahat ng vaccine. Ibig sabihin, talagang may chance ka pa rin na makahawa. Pero, yun nga, no, kung ang nahawa lang natin sa isa't isa is a mild type of infection, then it's sort of like flu lang, no, na taon-taon kaya natin siya i-manage. So I think that's the best way to go.
Okay, thank you, Doc Peps. Yes, Wendell, go ahead. Pwede ka mag-unmute.
Magandang hapon po.
Magandang hapon.
Tanong lang po
Saan po kayo, Wendell?
Sa Morong Rizal.
Opo, okay.
Tanong lang po, yung po ba mga doktor, kayo po ba nakapagpapaksina?
Sige, Wendell, ako po ay hindi pa kasi ang inuuna ho natin ay yung mga frontline health workers muna kasi ang dumating po natin mga kwan lang yan 1 million doses, yung Sinovac saka Astrazeneca. Ang inuuna ho muna natin ay yung mga doctor and mga nurses, midwife na nasa mga hospital level 3 buong Pilipinas. So PGH yan, meron din tayo sa mga provincial hospital, meron din tayo sa mga Davao, sa Mindanao. But pababa hanggang sa lahat ng doktor. So, aabutan ho kami dyan, pati si Doc Bem hanggang sa mga lahat ng Department of Health. So, yung A1 po, yung priority A1, sasakop po kami doon lahat kasi kasama doon pati mga barangay health workers, mga city health officers, pati yung mga nasa region office ng mga Department of Health. So, yun na pong A1. Dahil po sa kulang pa ang mga bakuna natin, inuna mo natin yung talagang nag-aasikaso sa mga pasyente.
Okay.
Pero marami na pong naturukan ng mga doktor. In fact, ang health workers natin ay, Bebs, ilan na bang nabakunahan natin? So more than 250,000 na ang nabakunahan po ng mga doktor, nurses, midwives, mga IWs, mga technicians na related po sa mga hospitals.
Okay, maraming salamat sa tanong mo, Wendell. At kung may tanong ka pa, pwede nyo i-chat naman or magtaas na lang ng kamay. Ang ibang tanong din, I think, para kay Doc Bebs, if your audio is working now, is yung practical rollout po ng vaccines. Kasi sa ngayon, nakikita po natin, niro-roll out na sa mga hospitals, lalo na sa mga level 3 hospitals. Pero pag tapos na po yung A1, na priority, how will the rest of the public, for example, the frontline essential workers, be receiving their vaccine? How do they register, number one? How do they know na pwede sila mag-register? And then eventually, pagdating sa public, sa general public, saan po kami pupunta to get this vaccine? Do we have to go to the hospitals or pwede sa trabaho po namin? Paano pag wala po kaming trabaho? Parang may audio problems ngayon muna si Doc Bev. Doc Eddie, meron po kayong idea kung
Okay.
paano?
Okay. Ganito po mangyayari po sa ngayon nasa hospital tayo. So meron tayong mga vaccination centers po Mga karamihan dito pag bumaba na tayo sa senior citizen, etc. Magiging local government unit na po ang mag-aayos yan. Ibig sabihin, sa lugar nyo, kung senior citizen ka, magpapalista ho kayo. Meron naman tayong master listing ng mga senior citizen, 16 above. Ang sunod po, yung mga less than 60 na may sakit, hypertension, diabetes, etc. Magpapalista rin kayo. So, ang master listing po ay ang local government unit. At ang mga local government unit naman po natin ay handa na sa mga vaccination area. So kung saan kayong lugar, sasabihan kayo kung saan kayo tuturukan at anong oras, kailan, meron pong schedule po yan at malalaman nyo po yan. So LGU po ang magsasabi ng mga schedule, pati kung saan na lugar.
Pero Doc Eddie, maraming umikot ngayon ng mga messages sa mga Facebook, Viber group tungkol sa mga private companies o kaya even mga hospitals or kung anumang groups na nag-offer ng vaccine. Of course, may corresponding fee daw at registration. Sanction po ba yun? Yan po ba ay normal? Or ano ba talaga yung dapat na paraan para magpabakuna sana?
Yes. Una, sabi nga ni Bev, bawal po ang magbenta ng una. Hindi po yan binibenta. So yung mga nagbebenta po, sabihin niyo sa amin sa DOH para i-report po kasi under sa guidance ng EUA po, bawal po benta yan. Now, may tripartite agreement ang mga private sector with the local governments and national government na pwedeng bumili sila. Pero ang pagkaintindi ko niyan, mga later part na yon pag naubos na natin yung mga priority group at pwede na sila. So kung paano gagawin yan, dapat makipag-coordinate ulit sa national government, saka sa DOH, saka sa local government unit. Kasi kahit ngayon po, yung mga bakuna natin bawa sa health workers, binabakunahan din natin from the national government kahit mga private practitioners, private hospital, private clinic, din natin. At no cost, kasi public good na yan para sa kanyo. So dapat ayusin din natin yan. So kung may nagbebenta po dyan sa inyo, i-report nyo sa amin kasi bawal talaga yan. Under EUA, bawal. But pag nag-roll out na yung public-private LGU corporation, ayusin ho natin kung paano. Kasi at the end of the day, sa tingin ko, dapat ma-coordinate niya ng LGU. Kasi LGU ang magsasabi kung kailan sila, mga yung workers man yan, frontline workers, or mga nasa transport.
Thank you, Doc Eddie. Doc Bebs, may dagdag ka ba doon sa question on yung mga vaccination ng mga companies, for example, they're vaccinating their workers, pati naman yung families, na employees. How will that happen kung may prioritization tayo? Are companies or private entities supposed to wait for the time to vaccinate their workers, especially kung hindi sila essential frontline workers? Tanong si Debbie. Sorry, Doc Beb, go ahead.
Dapat po ngayon po, we are all following the prioritization criteria, di ba? So assuming po na dumating na po yung mga bakuna, at that time, kinakailangan po, so we wanted to make sure lang na all of the private sector players who have actually bought the vaccines, as what Doc Eddie has mentioned po, hindi po nila yun pwede ibenta. So kailangan po, binibigay lang po nila yun sa employees nila for free. At kung gusto po nila bigyan yung...
I think may lag lang si Doc Bev sa Pero I think Doc Eddie nasabi mo naman kanina na hindi dapat ibenta muna kasi meron nga tayong prioritization na dapat sundan.
Yes.
Okay. Tawag ba natin si Jella Jimenez from the attendees. Ma'am, go ahead po. Unmute na lang po and ask your question. Sige, habang hinihintay natin si Miss Jella, may tanong po dito from Miss Debbie Bautista. What happens if the second dose of the Astrazeneca vaccine does not arrive on time now that the reserved second dose will be distributed as per President Duterte's instruction? Can the second dose be delayed po?
Yeah. Ang sabi sa atin na mga eksperto, dapat ang pagitan niya ay 12 weeks, So that yun ang maximum, so that parang booster yung second dose. So ang tanong kung wala pa yung second, will it affect? Sa totoo lang, sa tingin ko, kasi yung 12 weeks is actually para yung yung safe period na meron ka pang protection. Meaning, beyond 12 weeks, siguro 1 to 2 weeks, baka pwede pa. So, again, we will make sure po na darating po ang vaccine. Kaya nga, i-roll out po natin yan kasi yung WHO mismo ang nagsabi sa atin na parating na po ang second batch ang Astrazeneca, and therefore we will issue na yung second dose sa iba pang hindi nagbibigay. So we'll make sure po na darating before your next dose.
Okay, thank you. Balikan lang natin si Doc Bev, yung sagot niya kanina kasi medyo na naging choppy at naglag ng konti. So Doc Bev, any words on yung mga private sale of vaccines or private companies getting involved in the distribution ng vaccines?
Thank you, Zach. Just re-echoing what Doc Eddie has mentioned, dapat po libre po siya for their employees. And if they're gonna give it out to other than their employees, then the assumption po ay it's not gonna be for sale din po. No? Kasi yun po yung condition sa tripartite agreement. And then add lang din po ako dun sa last na mention ni Doc Ed. The evidence keeps coming out din po. No? So nauna po yung Astrazeneca, alam natin 4 weeks lang yung pagitan. Then there was evidence that showed na better yung effects kung 8 weeks. So temporarily naging 8 weeks sa guidelines. And ngayon dahil may lumabas na pag-aaral na mas mahaba, better, no? So 12 weeks. And so I think between now and the time na mababakunahan yung mga frontliners natin na nauna sa AstraZeneca, there might again be studies, no, that could actually show na by extending it further, I don't know, it could actually be even better. So yun din po yung dahilan bakit naka-on standby yung mga experts like Doc Eddie dun sa NITAG namin kasi they synthesize all these new evidence that comes out palagi at nagre-recommenda ng ways forward.
Thank you. Okay, may tanong, FB, Bayanihan Eco Store. Tanong ko lang po, if naabot na po yung herd immunity, ibig sabihin ba na ihihinto yung vaccination program? Or paano ba natin masasabi na abot na yung herd immunity dito in this particular case, no?
So yung ideal po na mangyayari, di ba, is ma-cover natin as much of the population. Pero ang question ngayon is, gaya po no, ng ating mga flu vaccines, kunwari, na every year binabago po yung some part of the flu vaccine para po to accommodate yung mga variants or mga mutations in the flu virus, di ba? Ganon din po yung mangyayari sa atin. Ang hindi lang po natin ngayon alam is gaano tayo kadalas no, magpapabakuna. Kasi ngayon, because we don't have the first trials were done less than a year ago, so yung follow-up period natin na longest is actually only around a year din, di ba? So hindi pa natin alam na effective ba to hanggang 2 years, 3 years, baka naman 5 years, no? So the evidence that will keep coming out of the scientific community will inform us. So kahit naka 70% na tayo, naka herd immunity na tayo, kung sa susunod, malaman natin, merong ibang variants that need to be accounted for, then we do another round of vaccination.
Tanong from Maria Regina Andrea Sison, how can standalone physicians, those without affiliations to hospitals, get vaccinated? What steps should we undertake?
They should register with their local government units who holds the master listing, no? And it's the local government units who certifies the list that is submitted to the DOH.
Okay. Isa pang question galing kay Michelle Calbayog. Yung libre po for employees yung vaccine, pero bakit may need for counterpart from the private sector? I think referring to yung donation program ng private sector with the government's vaccination or vaccine procurement program, no? Bakit may ganitong scheme ngayon?
So actually po, based po sa kila Sec. Charlie po to, no? So first, klaro po sa atin na the government has loaned amounts of money to get us supplies of the vaccine. Second, the private sector has volunteered, no, that they wanted to also put in some money for their employees, diba? But many of the companies that supply the vaccines, hindi po talaga sila nagde-deal with the private sector at this point. Bakit, no? Dahil the primary liability is actually now with the government because it's the government who brings in these vaccines dahil sinabi nga, diba, hindi pa tapos yung phase 3 trials, no? So dahil doon, hindi po siya pang-benta, hindi siya pang-market, so they don't deal with the private sector. So that said, no, kailangan po tatlo po tayo na nandun sa agreement. Kung hindi po papasok yung national government doon, hindi po sila kakausapin ng mga kumpanya. Now, what is the setup that we have, no? We still do have limited funds to consider, and some of the companies, international, the suppliers, have wanted down payments, for example, etc. No? which our law does not allow for, di ba? Alam natin, no, dito magiging mahirap yon kapag ginawa natin yon at wala sa batas, mahabla lahat ng mga gumagawa po ng response ngayon. No? So the support of the private sector went into that, no? Making sure that we were able to reserve some of the vaccines because their money, hindi naman sila subject to the government rules, di ba? Second, the important point that Sec. Charlie raised about this is the private sector was able, so kunwari tayo, ang willing nang natin talaga bilhin for certain brands, no? Kasi mas mahal sila, is say 10 million doses, for example. But the maker is selling to us 20, no? Kapag hindi natin kukunin yung 20, pupunta na lang sila sa isang bansa na kaya pong bilhin yung 20, no? Kasi parang, mas konti yung kailangan nilang i-deal na kliyente. So, kung ganun na mangyayari, we will lose some of the potential stocks also. And that's why this partnership also helps us secure yung mga may willing na magbigay sa bansa natin kahit the government will only be able to purchase a part of it, the private sector comes in. But I think we would like to emphasize that the private sector is actually not mandated to go into any of these arrangements. No, I think I went into some town halls na some of the smaller private schools, for example, they were asking, hala, paano kami? Yung kumpanya naman namin hindi bibili ng bakuna. It's no problem because the government is supposed to provide for you. No, so it's really the higher income private sector groups that have the extra money to bring out. They're actually the ones who went into the tripartite. But we're not expecting private groups nor small and medium enterprises, private din naman sila. No? We're not expecting all of you to shell out. No? So the policy is gobyerno yung magbibigay ng bakuna.
Okay, that's a good statement. Gobyerno magbibigay ng bakuna. Yes, Doc Eddie, go ahead.
Ito personal to, hindi to as a NITAG member, but isang citizen of the Philippines. Ako, pinag-aralan ko yung budget. We have 82.5 billion budget. Meron ng 12 billion na cash, may 10 billion tayo bayanihan, and then 70 billion loan approved na ng ADB, World Bank, etc. Anyway, having said that, kung ako ang presidente, sasabihin ko, importanteng vaccine, let's buy it. It's a public good, national government should procure. And ako ang titingin ko, tayo nang bumili kasi tayong bulk, mas makakamura tayo, and we have the money. Let's buy, di ba? And let kailangan pa rin natin private sector, saka local government. Kasi halimbawa, LGU, ang daming pang gagastusin ng LGUs in terms of vaccination. Ano yon? Yung pambili ng mga syringes, yung mga supplies, transport, training, iba pagkain, etc. So sila actually ang mag-i-implement ng vaccination. They have a lot of expenditures pa. Now, ang private sector naman, ang worry ko lang dyan, kung hahayaan natin yan, problema niya kanya-kanya. And even if hayaan natin sila, like for example, 20 million ng Moderna, 13 million sa Astrazeneca with the private sector. Ang tanong, kaya ba nila mag-implement? Tinanong ko mga private sector, hindi nila kaya. At the end of the day, it will be the vaccination centers of government. Diba? So kung gusto lang tumulong, pwede naman yun eh. But ang isa pang issue dyan is yung equity. No?
Yes.
Baka makinabang lang dyan yung mga malalaking kumpanya. Paano naman yung mga maliliit na kumpanya? Diba? But rest assured, ako ang tingin ko, this is a national program and everybody should be vaccinated. And according to our prioritization. Kasi nga, yung scarcity and pinaprioritize natin kasi inuuna nga natin yung mga kaya sabi namin tamang bakuna tapos tamang proseso, di ba? So if government have a lot of dami nating pork barrel, di ba? Dami namang intelligence fund, maraming perang pinaglalaanan sa anti-insurgency, bakit hindi sa vaccine? So part ito siguro ng papel ng mga taong bayan na magsabi na unahin niyo to kasi ito yung mas importante kaysa sa mga patayan. Yan lang po.
Maraming salamat, Doc Eddie, and very good words to that effect. I think ang takeaway ko naman sa sinabi niyo yung dalawa is that this is a coordinated effort between the public sector, the private sector, everyone involved, and unless we all work together, it will not be effective in terms of building our immunity. Thank you. I have a few questions, practical questions, then, and then maybe we can go to the wrap up. But may mga questions lang about mothers who are either pregnant or planning to get pregnant soon. Can they get the COVID-19 vaccine? And if they get the vaccine, ito ba ay napapasa sa anak nila? Sa child nila, sa baby?
Ano natin si Bebs kasi baka gusto niya mag-asawa si Beb. Beb, sagot.
So ano po, no, yung advice po ngayon is particularly for healthcare workers na nagbe-breastfeed, pregnant, beyond first trimester, advice po pa rin talaga na magpabakuna, no, kasi benefits outweigh the risk. Meron na pong mga konting ebidensya ng pagpapasko ng antibodies, no, ng protection through breastfeeding dun sa babies, pero hindi pa po marami, no? So konti pa lang yung scientific articles about it, but hopefully mas maging solid, no? But in any case, our Philippine Society ng Obstetrics and Gynecology, they recommend it, and then also mga pediatricians natin, no, na nag-promote ang breastfeeding, they also recommend it.
Okay, that's good. And then may tanong dito tungkol sa timelines pala kasi hindi natin na pag-usapan. When does the government or the Department of Health estimate that the public, those who are not on the priority list, will be able to start receiving vaccines?
So if we consider the senior citizens as the start na of the general public, diba? We are hoping that with the deliveries of the vaccine and later this month and early April, baka by mid-April, kasama na po yung senior citizens, no? Kasi complete na yung doses enough for the 1.8 million workers.
Mm-hmm. Okay. And will the vaccines po, may studies po ba about the vaccines against effectivity against these variants? Sa dami-dami ng variants ngayon. Will all of these vaccines be effective against the variants?
So far, no, tuloy lang tayo sa synthesize ng mga nakukuha nating studies from abroad na mga nauna ng mga countries na nag-roll out po ng vaccines. So far, the evidence is still that they have very strong protective effect po. Meron pong ibang bakuna, parang nabawasan po, no, ng mga 10% ang overall efficacy niya against yung mga virus na may variants. Pero yung good news po dun sa atin is kung ano man yung binawas dun sa protection, kaya po siyang punan ng minimum public health standards, no? So, bakuna plus face mask, face shield, physical distancing, hand washing, ventilation, kaya pong punan yung 10% na ibinaba po ng effectivity dahil sa variants.
And may question dito, nagmamatter po ba yung need for testing, for example, I think either testing or mass testing, habang naghihintay tayo ng vaccination program to roll out, how do we, and then I think nasabi mo kanina, Doc Bevs, na there's still that need to wear masks to practice the standard safety and health measures, no? So I guess the question is, does anything really change now that there's a vaccination program? Can we go back to work? Can we resume our lives as normal and wait for the vaccine? Or do we need to continue what we were doing earlier, maybe even because of the spike in number of cases per day, even strengthen these health measures?
That's right, Zach. It's very important na all the more maging consistent yung application natin. Nung actually alam naman na natin pero syempre mapapagod din naman talaga tayo, tao lang rin naman. But I think another important point to note is when the minimum public health standards and the vaccines coming in, when we probably have covered the health workers because they're at most risk and the senior citizens, a lot could probably change already for us, diba? Realistically. Kasi sila naman talaga yung ayaw natin, yung severe infection, no, na maapektuhan tayo. But on your question on testing, klaro naman sa atin, no, we're not for indiscriminate testing, but we want testing that's actually useful, no. And what we want to happen is, especially now with the cases increasing, the formula naman has already been laid out. The step-by-step things that the individual has to do, that the establishments, yung mga businesses, has to do, and more importantly, the local government, what they need to do is already laid out, no? So, kunwari po, may cluster of cases, alam na po nila dapat magsasara yung isang floor, isang bahay, ila-lockdown, diba? Or yung street, no? We're not talking about the entire city or entire municipality. Then, they need to do active surveillance, diba? And active surveillance entails really getting our community health workers to get to the houses and really do symptom check, di ba? At kung meron, kinakailangan kukunin sila at ipapadala no, sa ating mga isolation facility ng maaga, or syempre kung buong bahay na yon, doon na muna sila at sila yung papadalhan ng support. So actually, what needs to happen more is yung regularity no, nung gano'n, na very aware tayo na active surveillance yung kailangan. Hindi yung passive na, ay, dumami na yung kaso, tsaka na ulit tayo ma-alarm. So, that has to be done in the context of mass testing has to be done in that context. No? Na, okay, meron kang pinupuntahang mga bahay na sinasurveillance, so ito yung mga kailangan i-test. Hindi yung just anyone can raise their hand and do testing. No? Hindi siya systematic and it doesn't really help us address the clusters po. So, yun lang naman from our end.
Okay, thank you. Doc Eddie naman, one last question for you before we wrap up, no? Kasi I think sabi niyo kanina, the vaccine program will be up. It's really the LGUs or the mayors that will really roll out this program effectively. So number one, ano yung advice natin for LGUs, no? And how can we make sure that the vaccine is equitably rolled out, that the access to the vaccine is equitably distributed? Even if we know na yung capacity ng LGUs natin ay magkakaiba, like may mga mamayaman na LGUs, may mga low resource LGUs, how can we help all the mayors deliver this vaccine effectively and equitably?
Yeah. Yung slogan namin, no, dapat sundin natin yung tamang bakuna at tamang proseso. And when we say tamang bakuna, we will make sure na ang ibabakuna sa inyo ng mga local government units nyo ay safe at effective. For now, we have 4: Sinovac, Gamaleya, Pfizer, and Astrazeneca. More will be coming. Basta FDA approved tsaka HTA evaluated, okay yan sa atin. May mga precautions, individual, depende sa vaccine. No? So tamang bakuna dapat ang mapunta sa kanila. Number 2, dapat tamang proseso. Susundin ng mga LGUs yung ating prioritization. Dahil nga, una, ang mga health workers nila, kasi pag sila magkasakit, sino mag-aalaga sa inyo? Bakit senior citizen? Kasi sila yung tinatamaan talaga ng marami. Bakit yung mga adults na may comorbidities? Kasi sila rin talaga ang mga delikado. Di ba? And susunod, bakit yung mga frontline non-health workers? Ito yung mga nasa transportation, restaurant, sa market, etc. Bakit sila una? Kasi sila yung nasa high exposure, di ba? Saka sa pang-araw-araw. So, kailangan i-protect din natin sila. So, dapat may proseso tayo to the point na even yung mga teachers po, so mga may nakikinig po ng mga teachers, gusto natin ma-open ang ating mga schools. We have to vaccinate all the teachers, di ba? Nakalinya rin po siya, no? Kailangan natin sila. And therefore, yung proseso nila. And hindi ho pwede itong national government. Hindi kaya ng national government lang. Hindi rin kaya ng local government. Kailangan din natin private sector. But sana naman yung private sector, wag naman pasaway. Wag mag-unahan, wag magkanya-kanya. At the end of the day, it should be tamang proseso. So, hindi tayo nag-uuna ng makanya-kanyang kumpanya, kundi kanya-kanyang prioritized sectors. So, kailangan natin kayo kasi hindi rin kaya ng national government at local government. At mas importante sa akin, mas nakapaka-importante ay yung tayong mga mamamayan. Tayong teacher, tayong nasa NGO, tayong mga driver, tayong farmer, tayong mga ordinary na tao. Tayo, tingin ko, tayong pinaka-importante. Ang una kong suggestion, sa ngayon may surge, may variants, tapos magkaka-Holy Week. Ang suggestion ko po, kung akong tatanungin nyo, individually po, isipin na natin, stay at home muna tayo kasi wag na muna tayong pumunta sa hindi naman dapat puntahan, di ba? So, tapos kung may pupuntahan tayo, mag-mask. No? Simple lang, hindi lang dahil sa protection mo. Isipin mo ng protection na iba kasi posibleng meron ka pero siya wala, di ba? Makakahawa ka. So, tapos pag may nakita po kayong hindi nagmamask, sabihan nyo. And in fact, ito yung problema natin sa confidence sa atin. Kasi may mga leaders tayo na salita ng salita, hindi naman sinusunod, di ba? And therefore, tayo mga mamamayan, dapat we should also speak up. Sabihin natin, mali yung sabi na mask, kayo hindi nagmamask. Sabi nyo, wala dapat mga gathering, pero kayo nagpa-party-party, di ba? Hindi naman pwede yun. So therefore, tayong mga mamamayan, kailangan po magsalita. We do our own thing and we also walk the talk. Diba? Ibig sabihin, kung anong gusto natin gawin sa sarili natin, sa pamilya natin, gawin din natin. So that, and we have to be very, dapat magalit na rin tayo kasi 1 year na to di ba? 1 year na tayo hirap na Lahat naman hirap na Lahat tayo pagod na. And sana i-translate tayo sa galit to the point na gawin natin dapat gawin at we make the people in power responsible. Yan lang po.
Thank you, Doc Eddie. Hopefully bumalik na si Doc Bev. I think naputo lang siya. Pero yung last question ko lang for both of you is, alam po natin na frustrated po tayo lahat, medyo pagod na 1 year later. Pero what are you hopeful for, no? Is there something that we can still look forward to?
Kasi yung vaccination natin sa akin is failure is not an option. Kaya anumang political line ka, kaya anumang grupo ka, yellow ka man, red, or blue, or green, or pro-Duterte ka, or pro-Aquino, or anti, etc. This is the time to unite, okay? Alam ko mag-e-election, no? Mag-e-election at pipili tayo. Maiinit naman. But pagdating sa COVID, magkaisa ho tayo. Kasi ang kalaban natin, hindi naman si Duterte, hindi naman si Lenny, hindi naman si Marcos, hindi naman si Lacson, o si Duque, o si Galvez. Ang kalaban natin ay si COVID-19. So with that in mind, magsama-sama ho tayo. Gawin natin parang gera to kasi second year na natin to di ba? And sama-sama ho natin pagtulungan to. Pero pag sinabi ko pagtulungan, hindi naman pwedeng tahimik lang tayo. Kasi kung may mga leadership failure, then let's speak up so that people will toe the line. At importante dito sa vaccination natin is trust, no? Ang trust po mahirap hanapin yung paniwala ng tao. Pero kung naniniwala ang tao sa mga liderato, sa mga doktor, sa mga eksperto, susunod ho sila kasi kung makita nila na para sa atin lang naman pala to, talagang, so yun lang po ang panawagan ko sa atin. So everybody is, sabi ko nga ang lesson dito na hindi kaya ng national government, local government, pati experts, kaya to. It will take a massively distributed responsibility for all. Adapt tayo, learn, innovate, and talagang make war against this COVID-19. Yan lang po.
Maraming salamat, Doc Eddie Dorotan. Dr. Beverly, what are you hopeful for? Same question.
So I'm hopeful for the health sector kasi finally it's getting the attention that it needed. I'm hopeful because the investments that we have forever asked for, dahan-dahan pong actually nabigay during the pandemic, and these will be long-term investments. I am also hopeful because I work with a lot of young people who have dedicated their lives for public service, di ba? And that kahit ang daming naririnig na negative, etc., tuloy pa rin, no? Trabaho, serbisyo lang. And I think this is the kind of spirit that we want the health sector to have moving forward, the energy and the commitment to serve our people. So I think there's a lot to be hopeful for. There's silver lining, again, in what happened during the pandemic. Siguro, it's really up to us to make sure na hindi masayang yung opportunity, as what Doc Eddie would say, no? Magamit talaga itong opportunity to transform kung ano yung meron tayo ngayon.
Maraming salamat, Doc Bebs. And I am hopeful for this country because we have people like Dr. Eddie Dorotan and Dr. Beverly Ho who are working in the front lines. Kayo talaga yung mga frontliners, and so we want to thank you for your service. Thank you for all the work that you put in, long hours and the stress. Pero mukhang bata pa naman silang dalawa, no? So let's all thank them in the chat. If you can chat to our panelists, please put in your messages. And thank you again, Doc Bebs, Doc Eddie. Ingat po kayo, no? We'd like to also thank our partner organizations, Active Citizenship Foundation, Galing Pok Foundation, COVID-19 Action Network, and Ideals. Also, maraming salamat rin sa mga organizations na nakasama po natin ngayon, PNP Calabarzon, AFP Camp Aguinaldo, Akbayan Party List, Akbayan Youth, Frederick Ibert Stiftung, Institute of Politics and Governance, and the Student Council Alliance of the Philippines, at marami pang ibang organizations na nandito po ngayon. So thank you very much for watching us. Again, please do share this video. It will be up on the Facebook channels and other media channels. so that others may know what's happening and others may be informed and of course work together. Sama-sama po tayo dito to beat COVID-19. I'm Zach Yuson. Please stay safe and have a happy and healthy weekend. Ingat po tayong lahat. Maraming salamat po.